Thanks, Brian. To today's Health Watch and some important news. The measles outbreak, it continues to spread. It started in West Texas and is now spread all across the state, just outside of our viewing area. Now, so far, 11 cases have been reported in Lamar County. That's coming from the Texas Health and Human Services. They've identified 10 counties with outbreaks. And sadly, 2 children who lived in those areas have already died from the measles. And joining us now is Dr. John Vanchiere, the chief of LSU Health Shreveport Department of Pediatrics and Infectious Diseases. Great to see you, Dr. Vanchiere. Thanks a lot for taking time out of your busy schedule to chat with us.
Yeah, great to be with you, Nate. Thank you.
Well, let's get right to it, Doc. What's the very latest on what you're seeing right now when it comes to any potential measles cases, and if this is something that we obviously need to be concerned about here in the Arklatex and Shreveport and Bossier?
Right. So as of past day, no reported cases in the Arklatex area. Those cases in Lamar County up near Paris, Texas, are about 3 hours away from us, a little under 3 hours drive distance. And that doesn't present a high level of risk to our area. It's really, the importance right now is to take note. And, the state public health office and regional public health offices are preparing for the possibility that we would have measles outbreaks in the state of Louisiana. The good news is that our vaccination rates in most parts of Louisiana are very high, and remain so because the measles vaccine is a very effective and safe vaccine. Those families who may not be vaccinated against measles, or their children not vaccinated, should definitely pay attention to their travel and where they may go that might intersect with the ongoing places where there are outbreaks in Texas.
And thanks for breaking that down, Dr. Vanchiere. Now, obviously, some concern here is with the travel season. Obviously, the summer months are upon us here, and I suspect that measles probably won't be going anywhere anytime soon. So any sort of precautions in addition to getting those vaccines that you would recommend, especially for folks that may be headed west?
I think the important thing is just awareness of where those outbreaks are. Remember, measles is spread by the respiratory route, and its incubation period is fairly long, 7 to 21 days after exposure. And what that means is that exposure, you may not even know you've been exposed, but yet develop measles. And so, again, awareness of where there are outbreaks, understanding the risk, particularly to unvaccinated children and unvaccinated adults, and also those children and adults who are immune compromised in some way. They may be taking long-term steroids because of asthma. They may have an organ transplant or some other cancer chemotherapy that suppresses the immune system. Those are folks who will be at particularly high risk for severe disease. What we have known for a very long time is that about 1 out of 1,000 children who gets measles will die of measles. And the vaccine prevents death due to measles. Even kids who have been vaccinated can rarely get the measles, but they have mild cases. And the vast majority of those cases that have been reported in Texas and across the country, Kansas, Ohio, and other places, are in children and adults who have not been vaccinated. And so we really want to emphasize, if you're not vaccinated, consider it, talk to your healthcare provider, get current best information about these vaccines, because they are extremely effective and extremely safe.
Oh, fantastic advice, Dr. Vanchiere. And again, getting the word out now, I feel like such an important thing to do to keep those cases obviously as low as possible and not hopefully have an outbreak here in the Arklatex here in Shreveport Bossier. Well, thank you again, Dr. Vanchiere. Please pass along all our best to you and your great team there for keeping us safe and healthy. Thank you very much, sir.
Great. Thank you, Nate. Take care.